In the medical field, people are treated more like vehicles. Not really saying that people don't have some kind of value to the medical field. There seems to be a lack of human connection. The patient-doctor relationship, the relationship between the nurses and the doctors. There's distance. When you think about it, it's practical. What would a doctor be if he was an emotional wreck because his patient is not going to be well? That's not going to help the patient get better. Humans need that human connection. How do we cover that base? You know what I'm saying? Like, how do we actually cover that distance between the patient and the doctor without putting more stress on the doctor? Because the doctor's stress becomes the patient's stress. If you look at other cultures, like traditional Chinese medicine, Ayurveda, curanderismo, to be a curandero is to say that you're kind of like a spiritual doctor. That person who is the middle ground. That's what the curandero is. Curandero will always ask, we know what the doctor's recommending. I have some understanding about that. But I also understand that this person has emotions. And sometimes emotions are exactly what are tied to wellness. Psychoneuroimmunology. The mind and the emotions influence the immune system. So it's very important to be careful with that. Curanderos, they're really good at that. Same thing with Ayurvedic practitioners. Taking a look at what it needs. If we're going to improve this, if prevention is the best cure and we want to get that word out to the people, then we need to create jobs that focus on preventative treatment. If somebody's in their genetic history, the doctor finds out that their parents had diabetes, maybe they should have a health psychologist paired with them. The health psychologist could see the medical records. Did some blood work, the doctor sees that their blood sugar is kind of high. They're 29. That'd be diabetic by 40. How can we develop a treatment plan as care providers and professionals? How can we develop a treatment plan that allows for them, the patient, to learn more about what they can eat, what they should eat, and then having somebody follow up with them? This is what a health psychologist is for, is that they pop up and they're like, so, how's the sugar been? Have you been staying away from candy?
No, I haven't been adhering to your recommendations.
The health psychologist would be like, well, you know,
it's your life. If you don't want to have diabetes in your 40s,
then maybe you might want to consider eating less sugar. Eat an apple a day. Apple a day keeps the doctor away. Doctor's going to be happy if you ain't up in there talking about how sick you feel. We look at the medical field and we see that there's this big gap for communication and relationship building between patients and doctors, nurses and care providers. If we can cover this gap, we might actually create a revolution in health and well-being. We're going to see a lot of changes in the next 5 to 10 years, how medicine's practiced, but it all really depends on the major establishment. The changes are taking place within the people, but now they have to take place in the systems. The gatekeepers of the systems are the ones who get to decide. Like the psilocybin thing, which doctors approach to health, to well-being. The shaman's approach, if I may. It's powerful. Been around for thousands of years, bro. There's competing narratives. There's the science, there's the humanism, the money. There's so many narratives going on in medicine that it's hard to cover all the grounds. And really, it's hard to cover all the grounds without making some ground feel like there's no common ground. There's all these narratives and they all have needs and they all have logistics that have to be addressed. They have to be covered. But some of them contradict each other, or they create a push-pull effect where death is profitable. You got these insurance companies making all this money, somebody dies, they make more money, death is profitable. Over the last 50 years, most old people are still here. This is a different time in history. 100 years ago, people were dying from the flu. We still have people dying from the flu, but it's much less common. Now we have bigger problems. like heart disease, cancer, risky behaviors, suicide. We have bigger risks now. We want to treat people as what they are, humans in need of tender love and care. There's a responsibility that the system has towards that, no doubt, no doubt. I think it's also important that we take that same responsibility that we're putting on the system and put them on the people. And that's the thing, that's the issue. People are not perfect. A lot of people have trouble taking responsibility for themselves. I mean, shit, responsibility is a challenging thing. There's such a tug of war going on between the individual and the system, or the collective and the system, that people are playing the finger pointing game. And that's the lowest vibe thing to do. Point the finger and say, no, that's your job. Point the finger at somebody and say, no, you do that. It's always somebody else's responsibility.
We're sorry, the number you have dialed is not in service at this time.
So we have a responsibility issue at the core of the tug of war between systems and individuals. There are so many other conflicts of interest when it comes to money. You don't want to keep people happy and feeling good, right? Especially in a capitalist system. We want to be spending money. And if people are happy and feeling good, they're not spending money. People are spending money when they're miserable. One of the biggest things about the medical field is the people with insurance are the ones who go and almost, they're not abusing it, but they're so sensitive to their own well-being that they're going and they're exhausting supplies and resources that should be used for people who really need them. That's a big problem. There's a huge issue when I'm really looking at it. There's an issue between the individual taking responsibility for their own well-being instead of putting it on a system's hands. These gatekeepers, or these people who decide how the system operates, at least on a bigger scheme, they're human, they have blind spots, they have limitations. Some of them might have a lack of experience. There are people out there with a lot of money who do great things, and they're philanthropists, or they aren't looking around for some kind of validation. You know, there are lots of people out there who actually do want the best to happen. They do want humankind to grow. They want to see systems improved. They're not asking for anything in return. They're not doing it because of money or because of some kind of vanity. None of that. There are people out there. They're just not talked about as much. And it's really interesting because there's this imbalance of perception on looking at that, right? We know all the worst examples of people with money, and it's if anything, it's common that people with money want to keep more of their money, and they don't want to look out for others because they have an individualized mentality. They don't have a collectivized mentality. They're thinking, I worked for this money, I earned it, why should I give it up? There are people out there like that, and it is more common. It's really interesting how, which one is more influential, which one has more of like an effect on the system, because there are great doctors out there. There are great medical practitioners who listen to people and they actually make time. They laugh at the jokes with their patients. I've had doctors that I got along with really well. I know it sounds corny, but I mean, really, responsibility begins with the individual. We can't put the responsibility on the system. The system has a responsibility. At some point in life, we learn that responsibility is a choice. It just comes down to the choice, and it comes down to how often are you making that choice, and how difficult is it for that choice to be made. I think at some point, we're all really tall children. We're all just really tall children. We never get out of our terrible twos. We just learn how to regulate our emotions better, some more or less than others, based on foods, based on trauma, based on genetics, all these kinds of things, all these variables. And medicine, the medical field, doesn't educate as much as it could. All this knowledge and all this power that we have a responsibility to look out for each other and share with each other. I'm just gonna tell you this, in my life things got so dark and heavy, I had no choice but to become light. I didn't want to make any other choice but to become light, and that's kind of what it is. And everybody has a choice at the end of the day. We all make choices at the end of the day, and it's just up to whether we want to live with our choices or not. A lack of human connection. At the end of the day, kind of what it is. A lack of human connection. Kind of what it is. the individual and the system, a lack of human connection. At the end of the day, kind of what it is, and it's just up to whether we want to live with our choices or not.